Hey, you are listening to MedikaTalks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners. I'm Dr. Hope. Today, we will discuss about sleep apnea and how it can lead to serious disorders. Hello Dr. Lena. Welcome to our podcast for patients, caregivers and healthcare professionals at MedikaTalks. Dr. Lena, can you tell us about sleep apnea?
Yes, sure. Sleep apnea is basically a sleeping disorder that can lead to serious health problems, such as high blood pressure and heart trouble, if not treated on time. Untreated sleep apnea causes breathing to stop repeatedly during sleep, causing loud snoring and daytime tiredness, even with a full night's sleep. Sleep apnea can affect anyone, but most often elderly people who are overweight.
What happens if it is untreated?
Sleep apnea can cause a number of health problems, including hypertension, high blood pressure, stroke, cardiomyopathy, enlargement of the muscle tissue of the heart, heart failure, diabetes, and heart attacks. Untreated sleep apnea can also be responsible for job impairment, work-related accidents, and motor vehicle crashes, as well as underachievement in school in children and adolescents.
Who suffers from sleep apnea?
Sleep apnea occurs in about 25% of men and nearly 10% of women. Sleep apnea can affect people of all ages, including babies and children, and particularly people over the age of 50 and those who are overweight.
What causes sleep apnea?
Obstructive sleep apnea is caused by a blockage of the airway, usually when the soft tissue in the rear of the throat collapses during sleep. Central sleep apnea is usually observed in patients with central nervous system dysfunction, such as following a stroke or in patients with neuromuscular diseases. It is also common in patients with heart failure and other forms of heart, kidney, or lung disease.
What are the symptoms of sleep apnea?
Snoring, daytime sleepiness or fatigue, restlessness during sleep, frequent nighttime awakenings, sudden awakenings with a sensation of gasping or choking, dry mouth or sore throat upon awakening, cognitive impairment, such as trouble concentrating, forgetfulness or irritability, mood disturbances, depression or anxiety, night sweats, frequent nighttime urination, sexual dysfunction, headaches.
How is sleep apnea diagnosed?
Testing includes an overnight sleep study called a polysonogram, PSG. A PSG is performed in a sleep laboratory under the direct supervision of a trained technologist. For adults, a home sleep test, HST, can sometimes be performed instead. This is a modified type of sleep study that can be done in the comfort of home. It records fewer body functions than PSG, including airflow, breathing effort, blood oxygen levels, and snoring to confirm a diagnosis of moderate to severe obstructive sleep apnea.
What are the treatments for sleep apnea?
Conservative treatments. Overweight people can benefit from losing weight. Even a 10% weight loss can reduce the number of apneic events for most patients. Individuals with obstructive sleep apnea should avoid the use of alcohol and certain sleeping pills, which make the airway more likely to collapse during sleep and prolong the apneic periods. In some patients with mild obstructive sleep apnea, breathing pauses occur only when they sleep on their backs. In such cases, using a wedge pillow or other devices that help them sleep in a side position may help. People with sinus problems or nasal congestion should use nasal sprays or breathing strips to reduce snoring and improve airflow for more comfortable nighttime breathing. Mechanical therapy, positive airway pressure, PAP, therapy is the preferred initial treatment for most people with obstructive sleep apnea. With PAP therapy, patients wear a mask over their nose and/or mouth. An air blower gently forces air through the nose and/or mouth. The air pressure is adjusted so that it is just enough to prevent the upper airway tissues from collapsing during sleep. PAP therapy prevents airway closure while in use, but apnea episodes return when PAP is stopped or if it is used improperly. There are several styles and types of positive airway pressure devices depending on the specific needs of patients. Styles and types include CPAP, continuous positive airway pressure, is the most widely used of the PAP devices. The machine is set at one single pressure. Bilevel PAP uses one pressure during inhalation, breathing in, and a low pressure during exhalation, breathing out. There is a criterion that must be met before health insurance will cover the bilevel. This usually means that the CPAP machine must be tried first with no success, and these results documented before insurance will pay for a bilevel. Auto CPAP or auto bilevel PAP uses a range of pressures that self-regulates during use depending on pressure requirements detected by the machine. Adaptive servo ventilation, ASV, is a type of non-invasive ventilation that is used for patients with central sleep apnea, which acts to keep the airway open and delivers a mandatory breath when needed. Mandibular advancement devices. These are devices for patients with mild to moderate obstructive sleep apnea. Dental appliances or oral mandibular advancement devices that help to prevent the tongue from blocking the throat and/or advance the lower jaw forward can be made. These devices help keep the airway open during sleep.
So, Dr. Lena, what message would you like to give to society?
If left untreated, sleep apnea can result in a number of health problems including hypertension, stroke, arrhythmias, cardiomyopathy, enlargement of the muscle tissue of the heart, heart failure, diabetes, obesity and heart attacks. So, one should get themselves checked by a pulmonologist and understand the level of severity.
Thank you, doctor, for being a part of MedikaTalk and sharing your insights. We are hopeful that the importance of sleep apnea management mentioned by you will help in saving lives.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.